I'm your host, Amberlyn Carroll. Thank you for joining us on this episode of Medwatch Today. Jeff Janzen works in Community Health Systems Finance Department and understands the organization's commitment to providing advanced health care in the Central Valley. So when he received a stage 4 cancer diagnosis, he knew exactly where to turn.
I noticed I had on the inside of my tongue on the right side down towards the bottom, I noticed a white spot, and then I thought it would just go away.
Jeff decided to call his dentist and make an appointment. From there, his dentist referred him out to get a biopsy, and in December of 2021, Jeff was diagnosed with tongue cancer.
It was pretty tough. Nobody wants to find out they have cancer, and then to find out that it was, stage 4. Normally you have stage 4 cancers, and it's pretty much the end of the road.
In January of 2022, Jeff found himself at the Community Cancer Institute with Dr. Robert Julian and Dr. Brian Woo.
Jeff presented with a tongue cancer and shown to be a carcinoma, a squamous cell carcinoma, which is the most common head and neck cancer that we see.
Jeff was set for oral maxillofacial surgery, where his tongue would be reconstructed.
We had set him up to go ahead and treat his cancer by surgically resecting the cancer of his tongue, but then we had to reconstruct it also. And so to help reconstruct his tongue, we take tissue from other parts of the body. For him, we went ahead and used tissue from his arm. And it's almost like an organ transplant from his own body, and we used that to reconstruct his tongue, both for speech and swallowing and for just everyday function. In the Central Valley, we're the only ones performing it right now in terms of reconstructing with tissue from elsewhere around the body.
After surgery, Jeff worked with Dr. Nhat-Long Pham to start radiation and chemotherapy.
Initially, when we see patients, we first make sure that we have a proper staging for the cancer and make sure that is it confined to the tongue, has it spread to the lymph node, or have it spread outside of the head and neck.
But in February of 2022, Dr. Nhat-Long Pham discovered Jeff's cancer had returned.
In follow-up imaging, before they were starting the radiation, we noticed an additional lymph node down lower in the neck.
And Jeff underwent a second surgery with Dr. Julian to remove the returned cancer.
And the plan for him was surgical removal of lymph nodes from the neck, and a neck dissection, if you will, followed by radiation and even chemotherapy.
Coordination of care is extremely important for patients experiencing a cancer diagnosis.
Everybody was on top of everything, after the surgery.
We work very tightly together to take care of our patient, from the day that patient were initially diagnosed with cancer, get through the staging procedure, get through the surgery, and then come back to see me, and we review the final pathology together to determine whether the patient need additional treatment or not.
The Community Cancer Institute has all services in one building, so patients have one-stop access to advanced care.
Everything is right there at that one spot. You don't have to go anywhere else.
Allowing Jeff to continue a cancer journey without leaving the Central Valley.
Going back to those moments of being there with any individual, but in this case Jeff, and coaching them through a single moment that we take for granted.
Jeff worked closely with Crystal Rodriguez in rehabilitation therapy services at Clovis to get back his everyday functions after surgery.
A big part of that is speech and swallowing. That's where a speech language pathologist comes in. And so it does require extensive therapy throughout the course of the entire oncology treatment. He was able to restore a diet with just some compensatory strategies, as we would call them, diet modifications. But after the second surgery, it was a lot more challenging. So little things like swallowing saliva, being able to articulate a sound, it became very, very complicated. How do we coach to swallow just something we never have to think about?
Today, Jeff is cancer-free, but is still on the road to recovery.
I'm feeling good. I am a year out from radiation and chemo, but I am improving every day, and I owe it all to my team.
Tongue cancer can usually be attributed to a long history of smoking, chewing tobacco, or excessive alcohol use. However, for Jeff, none of those risk factors apply to his lifestyle.
We are still learning about the biology of this new cancer because it's not associated with either smoking or heavy alcohol use. But how does patient develop this cancer in this setting? This is something new that we are still constantly trying to learn.
Well, unfortunately, many patients will have an oral cancer present or other types of cancer where they really have minimal symptoms early on.
Dr. Julian recommends seeing your primary care physician immediately if you experience anything different in your body.
The earlier we diagnose something, the better the prognosis and the more options we have to treat it.
Although Jeff's cancer journey is far from over, he is continuing his speech therapy and achieving a high quality of life right here in the place he calls home.
I wouldn't be here without you guys. I mean, that's the God's honest truth.